freedom to get back to normal. Together, the federal government, the state, the city, and we at the county, together, we're getting the vaccine out. In just a little over a week, over 46,000 people have been vaccinated at the Wolstein Center. Over 340,000 people, residents in the county, have received at least one vaccine. Almost 28% of our population. Thanks to FEMA and the governor, the vaccines are really starting to flow. Starting Monday, everyone 16 and up will be eligible. That throws the gates wide open. While many county residents are getting vaccinated, the percentage of Black and brown people getting vaccinated is still way too low. We need to make sure that everyone in the county has the chance to get a vaccine. In the last couple of weeks, we've been working hard to help our Black and brown residents get access. So what are we doing? We're supporting the over 300 community partners that are on the ground in the communities, providing residents with information about the safety and the importance of the vaccine. Some of those partners include the Urban League, NAACP, Global Cleveland, the Hispanic Roundtable, the Spanish American Committee, libraries, and many religious organizations and congregations. These partners are helping to register residents for additional slots set aside just for underserved residents. Their efforts and dedication are invaluable, and they're instrumental in increasing the number of minority residents who get the shot. One of the reasons Wolstein was picked as the mass vaccination site is its location near highways and public transit. But people without a car or money for bus fare still need access, which is why we're providing free transportation to the Wolstein Center. We're helping to fund the United Way of Greater Cleveland's 211 line, which you can call to get help registering for the vaccine and to learn how to connect with our free transportation options. We've provided libraries, community organizations, and senior centers with free RTA passes that people can use to get to CSU. Since last weekend, we've pushed out over 3,300 passes, and we're planning to distribute more than 6,000 more. The state's also providing grant funding for additional free passes for existing paratransit riders. This is going to give transportation access to thousands of county residents and ease the burden of making the trip to the Wolstein Center. And remember, the Wolstein Center is not the only place where you can get vaccinated. With eligibility opening up to almost everyone, it may be difficult to reserve a spot at the mass vaccination site. Cuyahoga County currently has over 100 vaccination sites, some of which may be much closer to you than the Wolstein Center. There are two easy ways you can register for a vaccine. You can visit cuyahogacounty.us/vax and click on Register for a Vaccine, or you can call 211 to speak with a representative who can help you get registered. Both methods will provide you with information on the closest vaccination site for you. We're also going out into the community to get people registered. We've been staffing outreach vans and driving through neighborhoods with FEMA personnel to sign people up to get their shots. And this is another place where we're now handing out these free RTA passes. But we know that even if we provide free transportation to hundreds of sites, it'll still be difficult for some people to make it out to get their vaccine. So we're working with the state and FEMA to offer mobile vaccination options to go out into neighborhoods. This would be a great option, especially for people who have mobility issues or a chronic disease. As we continue to get thousands of residents vaccinated each day, our future is looking bright. At this rate, summer will be spent with friends and family. Kids will see their friends again in school, and people will start going back into work. But we also need to be realistic. Our economy is far from recovered. Thousands of workers are still out of jobs and families are still struggling to pay their bills. With help from the CARES Act passed last year, we were able to help thousands of county residents get through the crisis. For example, we gave $10.5 million to help local small businesses to survive. We provided internet access to over 7,000 residents and made over 11,000 computers and laptops available to families. And we provided $11 million to families through our rent relief, utility, and mortgage assistance funds. And we just put forth an additional $10 million for rent relief to help residents who are having difficulty making rent payments due to the pandemic. And another $1 million to the Legal Aid Society of Cleveland to provide legal assistance to renters facing eviction due to lost income from COVID. Free legal representation will be critical to preventing mass evictions in the coming months. The Biden administration just passed a new stimulus package called the American Rescue Plan. That provides us with additional resources which we'll use to continue and to expand our efforts to enable county residents to survive the pandemic and to thrive as we come out of it. But I do want to address one issue of bad news. I feel strongly that the health orders issued by Governor DeWine, his health department, and our local board of health, led by Terry Allen, these have been tremendously important. These orders, done with urgency during an emergency, were critical to slow the spread of the virus, to keep people healthy, and to save lives. Yet, the state legislature this week overrode the governor's veto of legislation designed to stop the governor and health officials from taking emergency steps to protect the public. I am very concerned that this legislation, passed for political reasons, puts all of us at risk during this and future emergencies. And now I'll turn it over to Health Director Terry Allen.
Terry, you're muted. I'm sorry.
It's been a while, folks. Sorry about that.
You have to start
I get
all
back
over.
in the groove again, right? Yes, I'll start over. Glad to be back with everyone. It's been a while, and we still here together. Glad to be back here with Executive Budish virtually, which is a safe thing to do, but there'll come a time when we can brief all of you together again in the same place. So I want to thank Armond for his support and County Council's support throughout this pandemic. He's consistently been an ally and a champion of public health and all the people that we work to protect together, along with our partners. And so I just wanted to thank you for that stalwart support, and also echo your comments around the override of the governor's veto of Senate Bill 22. We know that isolation and quarantine are the major tenets for public health prevention around diseases like tuberculosis and meningitis, and certainly important components for these novel viruses like COVID or Ebola, or during H1N1 during the influenza pandemic in 2009. And so these are critical tools to stop the spread of the virus in the community and save lives and prevent hospitalizations. So taking away these tools are akin to taking a fire hose away from a firefighter that they would use to stop the flames from spreading in a fire. And so I think it's unfortunate, and these are critical tools that have served public health well and prevented disease. And we hope that there's a chance to revisit this legislation and to better allow public health to use those tools judiciously as they have. So that's important to us. So echoing Executive Budish's comments, it has been some time since our last briefing. And we've all witnessed the remarkable progress that's been made in Greater Cleveland on our path toward a sense of normalcy in our lives. Our case numbers have been dropping, and our vaccination rates across the county and region have been climbing. Fatalities have plummeted, and many families have been thankfully reunited safely with loved ones in long-term care facilities. And we know that these have been very emotional moments for families, given the long separation because of COVID. The FEMA vaccination site at Wolstein, as the executive mentioned, has added wind to our sails in our extensive local vaccination efforts, with greater than 1 in 4 residents having already started vaccination in our county. The Cuyahoga County Board of Health, in concert with the Cleveland Department of Public Health, hospitals, community health centers, and pharmacies, are all working overtime to expand vaccination access to residents closer to home. We've continued to hold our large points of dispensing, or pods, as well as small community clinics to meet our equity imperative, working with the faith community and nonprofits to improve access for everyone to get a fair shot at this life-saving vaccine. More vaccine is being distributed across the state with each passing week, and more providers are distributing those vaccines throughout the county, and there is much to celebrate. Even as more of us get vaccinated, we have to continue what has been a major community effort to assure that everyone has a fair opportunity to get vaccinated. As Executive Budish noted, an army of community partners from local government, the faith community, and nonprofits have been working together, meeting every day with state and federal partners to promote vaccine access, particularly through the Wolstein Center. It's been an impressive mobilization to assure that everyone has the information and resources they need when they're ready to get vaccinated. On the prevention front, we've all learned together how to best protect ourselves and the people around us from COVID. The collective commitment to masking and distancing and remote work and avoiding large gatherings, the case investigation and tracing work that we do, the suppression of disease clusters, and vaccination campaign have all paid off. And this is great news. We know that these are the tools for this pandemic. While we're a far from our high of over 1,000 cases per day at the peak of the pandemic in the winter, our county remains at red level 3, indicating high transmission for COVID at about 1.6 times the CDC threshold for high transmission. Over the past few weeks in the county and across Ohio, case rates have plateaued and are not trending downward at this time. Cuyahoga County residents we're now looking at a rate that currently stands at about 162 cases per 100,000 residents. Governor DeWine has indicated that when Ohio reaches 50 cases per 100,000 residents, that he'll lift all the state orders. We are in a very challenging period of this pandemic. Everyone wants to get past this difficult year, and spring fever is a natural reaction. We must remember that our vigilance has been the way to fight back against this pandemic, and we need to stick with what works. If we look at the CDC data for states like Michigan and Florida and California, they remind us that we're not out of the woods yet. Variant strains like the UK B117 strain are emerging across the United States and right here at home in Cuyahoga County, because that's what viruses do. Those infected with COVID-19 need to isolate themselves to protect their loved ones and friends, just as they have throughout the winter. Those exposed to someone infected should quarantine, and according to the public health guidance, and we've learned that these measures are also very effective at slowing the spread of the virus. We know that these vaccines are safe and effective, keeping people healthy and saving lives. We have worked with radio and media outlets and our county administration to develop videos from trusted medical professionals on our Board of Health, including our Board of Health President, Dr. Greg Hall, and Dr. Sherry Williams, and others, to share the importance of vaccination, particularly in communities of color. So please check out on our YouTube channel to see these videos. There's also been a lot of community meetings to talk with folks so that they understand the vaccine is safe, and to allow them to ask the questions that they need answered in order to make the decision to be vaccinated. As noted, the county executive and county council continue to fund a team of operators at United Way 211 First Call for Help to assist eligible people with signing up for vaccination. This is a great resource that can be accessed just by dialing 211. Also, transportation assistance, as the executive mentioned, is a great resource to connect people with community clinics all over the county. We continue to work with the County Department of Senior and Adult Services, our community senior centers, the Western Reserve Area Agency on Aging, the Cuyahoga County Library System, and others to best reach our senior population in the expanded eligibility for vaccination. And we know that the demand for vaccines still outweighs the current supply. We're urging continued patience as it's getting better and easier to find a vaccine every week. I want to remind you that if you've pre-registered with us but received your first dose from a different vaccine provider, we would like to remove your name from our list so we can make a spot available for someone else that hasn't yet received their first dose. And you can help us by emailing us to let us know. We'll open up that spot by just emailing COVID-19-unsubscribe at cuyahogacounty.us. That's COVID-19-unsubscribe at cuyahogacounty.us. Spring has indeed sprung, and there's much to be thankful for. We just need to roll up our sleeves, get that vaccination, and hang on a bit longer. Before I transition, I want to take a moment to thank someone. We've been working hard with an equity group since the spring, providing things like food or medication or other resources to folks in need that may be in quarantine or isolation, and have transitioned to work in the equity group here locally to assist with increasing equitable access to vaccination among a range of populations, working with faith communities and others to provide vaccines close to home where people can access them. And so I want to take a moment to thank Michelle Shaw, who's been leading our equity group and is today in Cleveland Heights providing vaccinations in coordination with a few churches and the City of Cleveland Heights Community Center. So we thank you, Michelle, for all you've given and continue to give to assure that everybody has a fair shot at this life-saving vaccine. And with that, I'd like to transition to our director, Jana Rush, who will provide an overview of our data brief. Thank you.
Okay, good afternoon, everyone. So I'll cover our data brief today, just an update on where we are with our COVID-19 response. So as Commissioner Allen has stated, the number of cases reported in our jurisdiction remains at a high level for the county. So we're currently still at level 3, according to the Ohio Public Health Advisory System. So we're currently at approximately 167 cases per 100,000 residents, and that is higher than what the overall state rate is, which is 147 cases per 100,000 residents across the state. So as of today, we have over 71,000 cases reported to date. We're currently averaging about 132 cases per day being reported in the county. This is still higher than what our average was back at our initial spike in cases over the summer. The number of cases reported this week we had 928 new cases reported. That is a slight decline from where we were the prior week at 973 new cases reported. We had 25 new patients that have been hospitalized this past week. And overall hospitalizations have been stable at about 6% of our case volume. We have 1,469 deaths reported in the CCBH jurisdiction. So that's about 72% of the overall total deaths that have been reported throughout the entire county. 19 new deaths were reported this past week, and that's remained fairly stable compared to the 22 that were reported the prior week. And we've had an average of 7 deaths reported per day starting in January, and that's over a 50% decline. So those have dropped significantly from where we were back in December. Okay, we can go to the next section. So for our case demographics, these have also remained stable in relation to sex, age, occupation, as well as pre-existing conditions. However, we continue to be concerned about the Black-white inequity ratio. Blacks are still 2.5 times more likely to be hospitalized than whites. Next section. Okay, so this is our Epi Curve, and as you can see, it's covering the number of onset of illness by our cases. And so you can see the spikes that are happening there and how we're starting to level off here now that we're moving into the spring. But again, we're still slightly higher than where we were back in the summer. Next section. And so this is the distribution of cases geographically. Again, this has remained stable over the course of the pandemic back since the summer. So we haven't seen a significant shift in the frequency of cases by these zip codes. Next section. Okay, so our hospital utilization rates. So these have also remained stable over the past several weeks. However, the critical care adult beds, those have increased slightly by 4%. But overall, hospitalizations due to COVID has significantly declined since December. So still trending in the right direction there. And we can go to the next section. And so for our positivity rates, so our testing positivity rates, they've remained stable as well at about 4.5%. We have been running about 20,000 tests each week over the past 6 weeks or so. So there hasn't been a change, but again, the positivity rate has continued to decline. Our nursing home positivity rate has also remained stable at about 8%. So a lot of vaccination coverage has happened within our congregate care settings. So we are starting to see the positive results decline significantly in our congregate care settings, such as nursing homes. Next section. Okay, so this is the data over vaccination, which is something new that we've added over the past month. And so 27% of Cuyahoga County residents have received their vaccination. So that's approximately 300,000 people. And 13% of the population has received their second dose of the vaccine or completed the series. And that's about 160,000 individuals. We can go to the next section. And so here is a breakdown specifically of the Board of Health's administration of the vaccine. And so we've delivered 17,300 vaccinations. People have started their vaccination, and over 10,000 of those people have received their second dose of the vaccine. So they've completed the series. Females represent 61% of those vaccinated, and 60 to 69-year-olds represent the largest proportion of the age group that has been vaccinated. 73% of those vaccinated are white, and 17% are Black or African American, 4% are Asian, and 2% identify as Hispanic. Something that I want to make of note here with the data is that our reach within the African American community population has grown over the past month. So we've added an additional 7% of the population that we've reached in the African American community. So we are making strides and progress in order to reach minority and underserved communities. And so in closing, or in summary, I will say that we still have a high level of infection within the community, particularly with the new variant strands. They will continue to circulate. So we must continue to prevent the reverse of all of the efforts that we've put forward so far to move along in these efforts to end the pandemic. So I'm hopeful that we will continue to increase our vaccination rates in our communities with the ultimate goal of preventing hospitalizations and death throughout the community, and move in the right direction over the months to come as we press forward to ending this pandemic. And so I'll end with that vaccines save lives. Thank you.
Thank you all very much for your remarks. We now have a few minutes for some questions. As a reminder, please state your name and media organization when asking a question, and please remember to stay muted when not speaking. So with that, we can get a question or two.
Hi, it's Ron Regan here at News 5.
Hi, Ron, go ahead.
And this question, hi, it's Ron Regan at News 5, and this is for Commissioner Allen. The governor has released a list of 52 nursing homes and 155 assisted living facilities that have not opted into the vaccine maintenance program or confirmed how they're going to provide. He's very concerned about that. Do you share that same concern? And what can you do?
Right. I think certainly we share the concern. We've been working closely with those partners, and our hearts go out to the facilities, the administrators that have gone through a very, very difficult time. I have burned into my memory the last spring, with all the fatalities and all the hospitalizations that occurred related to nursing homes, as everyone was battling and understanding how this virus works. And so they've had quite a year themselves and have been interested, certainly we understand, in protecting those residents and worried about their safety. And so it's been an impossible situation where you want to protect the residents that you're charged with protecting. At the same time, their family members are missing their parents and grandparents, their loved ones. And so it was a very, very difficult circumstance. What we have now is the need to, in order to keep those doors open and keep those visitations happening, that maintenance contract is critical. What do we know? We know that we're seeing high rates of vaccination among our seniors, 75 to 80% or higher among many nursing home residents are vaccinated now. We saw a lower percentage of workers, about 40% were vaccinated. So we also know that we have turnover in any industry. So the continuation vaccination program is essential. It's essential to make sure that we continue to protect those seniors and keep that space safe so we can continue visitation. So we share the concern. We can certainly echo that. Among our partners, we still collect data on a weekly basis from nursing homes on their cases, and those reports are published, as everyone knows, on the state website. So health departments across Ohio continue to work with our nursing home partners. We would strongly encourage them to develop that relationship and maintain it. It just makes good sense, and the governor has been working to set that up. So we will echo that sentiment among the partners that we have in the nursing home industry.
Thank you, Ron. Any other questions? Okay. Well, thank you, Ron, for your question. Really appreciate it. That concludes today's briefing. Thank you so much for joining us today, and we will see you in a few weeks. Have a great weekend. Take care.
Well, thank everybody for being here today. We have with us Director Steve McCraw, who is the Director of the Texas Department of Public Safety. We have Andrea Sparks, who I will tell you more about before she gives her remarks, as well as Christy Lopez, who works with a leader of what's called Traffic 911, and she'll tell you more about what she does momentarily. Let me begin with this. across the street from where we gather today at the K. Bailey Hutchinson Convention Center is where the Biden administration is preparing to house up to 3,000 unaccompanied minors who cross the border. Similar sites exist in Carrizo Springs, Texas, as well as Midland, Texas, and that's just as of now. The way that we see the number of unaccompanied minors crossing the border, there's every reason for Americans to expect the number and size of those sites to continue to increase in the coming days. These sites are a direct result of President Biden's reckless open border policies that are causing a surge in border crossings and cartel activity. The administration has yet to provide answers that Texans deserve. How long will these children be here? What countries have they come from, and what COVID variants have they been exposed to? Are they being tested for COVID, and if so, how is the administration handling those who test positive? Is the federal government following CDC quarantine protocols? What happens to these children if they do test positive for COVID, and if they do become ill, who is it that's going to be taking care of them? The Biden administration must also answer for enticing unaccompanied minors into inhumane conditions that expose these children to traffickers, to abuse, and to terror. So far this year, more than 11,000 minors have been apprehended crossing the border into Texas. Children crossing the border rose 60% from January to February to more than 9,400 in February. The number of migrants crossing the border is at the highest since March 2019 and is on pace to hit a 20-year high. On Monday alone, the Border Patrol took in about 280 child migrants in the Rio Grande Valley sector. America needs to know how these children, some are young children, how they are coming across the border, and who is it that is helping these children come across the border. Americans need to know whether or not these children were harmed or abused in any way. They need to know if these children were assisted, coerced, or threatened by cartel members or by human traffickers. Were they forced to carry contraband as they made the trek across Mexico to the American border? All of this is vital information that can help America combat these human traffickers and prevent other children from being victimized. Americans deserve to know what the Biden administration is doing to get those answers. And Americans deserve to know what the Biden administration is doing to go after these human traffickers who are preying upon these young children. The Biden administration, to get those answers, should interview every unaccompanied child coming across the border. They should determine if any child has been harmed in any way or victimized by human traffickers. Things like this are already being done very professionally and very compassionately for children in America who are victims of human trafficking. The children coming across the border, they may share information about human traffickers or other abusers. This information can help us root out human trafficking as well as other criminal activity. Now, doing these things is the federal government's responsibility. But once again, it is Texas stepping up and doing what the federal government should be doing. Weeks ago, I launched Operation Lone Star to help secure the border and combat the smuggling of people and drugs into Texas. The Texas Department of Public Safety has deployed 1,000 DPS officers, agents, and rangers to support Operation Lone Star. Today, we are expanding the scope of Operation Lone Star to crack down on human trafficking. The Department of Public Safety will work with the already long-standing Governor's Child Sex Trafficking Team, as well as with other organizations and agencies that have experience in dealing with human trafficking and child trafficking. The Texas Department of Public Safety